Thank you all for joining us for an unusual COVID-19 update for today, May 24th. It's certainly not the May 24th weekend that we had all hoped for in some parts of our province, but I want to reassure everybody that the outbreak that's presently upon us is being looked after with the diligence and responsibility that Dr. Fitzgerald and her team have put forth from the very beginning. We are on top of this. We will get through it. I encourage everyone, despite the anxiety and the stress that they may feel, especially in central Newfoundland right now, please remain calm, follow the rules, and above all else, please get vaccinated. So with that, I'll turn it over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good morning, everyone. Thanks for joining us today. So we'll start with an update. Since media advisory yesterday, we have 4 new confirmed cases of COVID-19 in the province. One is in Eastern Health, and the person is between the age of 40 and 49, and it's related to travel. And there are 3 new confirmed positive cases associated with the outbreak in Central, one between the ages of 20 and 39, one between the ages of 40 and 49, and one between the ages of 50 and 59. There are 9 presumptive positive cases still associated with the outbreak and 1 probable case. The total number of cases in our province is now 1,257, and there have been 3 new recoveries since yesterday in Eastern Health, leaving 88 active cases in the province. A total of 141,787 individuals have been tested to date. The outbreak in Central Health Region continues to escalate, and we now have a total of 32 confirmed cases associated with this cluster, as well as 9 presumptive and 1 probable case. Our next course of action is to expand restrictions where there is an increased risk of transmission. We are finding more contacts and positive cases associated with this outbreak outside of the communities currently under Alert Level 4. And as a result, effective immediately, all communities along the TCH Route 1 from Gambo to Badger will move to Alert Level 4, as well as communities along highway routes 320, 330, 340, and 350, and most of the branches of these routes. And these routes are delineated in the special measures order, which will be posted. It is crucial for us to be proactive, recognizing the interconnectedness of these communities, and to minimize contacts where there is evidence that COVID is circulating. So under Alert Level 4, we recommend you work from home where possible. You must stay within your household bubble whenever you're not at work or school. You can expand your bubble by a small amount to connect with immediate family when necessary, bring in caregivers, or support isolated people. Gatherings are not permitted except for religious and cultural ceremonies. And gatherings at funerals, weddings, burials, religious and cultural ceremonies are limited to no more than 10 people, including the officiant, and physical distancing is required, of course. Public visitations and wakes are prohibited. Outdoor playgrounds and equipment can be used when operators allow. Gym and fitness facilities, yoga studios, swimming pools, tennis and squash facilities, arenas and dance studios are closed. Group and team sports, arts and recreation activities are suspended, and performance spaces are closed. Excuse me. Childcare services can operate at full capacity, and retail stores can open at 50% capacity and with physical distancing. Personal service establishments can open in accordance with guidelines, and restaurants are closed for in-person dining. Takeout and delivery and drive-through options are permitted. Bars, lounges, cinemas, and bingo halls are closed. Campgrounds and RV parks in this area can remain open. If you live in the affected region and you have no symptoms and have not been advised to self-isolate for any reason, you may go to these parks, but you must stay in your household bubble. We encourage you to enjoy the outdoors as long as you're sticking to your very close household contacts as outlined for Alert Level 4. Travel to and from this region should only be for essential reasons such as work, medical care, or essential support. If anyone has traveled to the affected region for the long weekend, you can return home. However, we do recommend that you monitor your symptoms for the next 14 days. And if you have any symptoms, even if it's just one mild symptom, you should get tested and isolate until you get a negative test result and your symptoms have been resolved for 24 hours. Testing is available for anyone in these affected communities. So please get tested, even if you do not have symptoms. If you are in this region and you do have symptoms, it is very likely not a cold. So please get tested and self-isolate. If your test is negative, you must continue to self-isolate until 24 hours after your symptoms have passed. If public health has advised that you are a close contact of a positive case, or you have been notified that you have potentially been exposed to COVID through public advisory, you must get tested and self-isolate for 14 days, regardless of your test result. Vaccination clinics remain open in these communities. If you're not symptomatic and you're not self-isolating for any reason, please proceed with your vaccination. If you are self-isolating, please contact public health in the region for further information. As a recap, for those who may have just joined us, we have 4 new confirmed cases since yesterday's media advisory, and the total number of cases in the province is 1,257. We live in a very tight-knit province, and news spreads incredibly fast in small communities. So I caution you not to judge individuals who have tested positive for COVID-19. This could be any one of us. Stigmatization will not help them, and it will not help the efforts of public health officials. We need to find and contain every single case of all the contacts of all the contacts of all the cases. People need to feel safe coming forward for testing. So let's show these communities that we are behind them and supporting them, because we're all in this together. This is not our first time staring down the face of COVID, and I have every confidence that we can put a stop to this outbreak just as we have before. But the only way is for everyone to adhere to the public health directives as outlined. So hold fast, Newfoundland and Labrador, and please take care and stay safe. Thank you.
Well, thank you, Dr. Fitzgerald. Again, not the May 24th weekend that we had all necessarily hoped for, especially in central Newfoundland. But as Dr. Fitzgerald said, we have taken definitive decisions in the past to help flatten the curve of COVID-19, and today is no different. We've learned lessons from the past, and we'll continue to build to ensure that we're doing what we need to do to make sure that people are safe from COVID-19. That said, I know it's a stressful, anxious time for people, especially in the affected communities. And I had the pleasure of speaking with some of the mayors last night, and I felt the sense of anxiety and stress. But I also felt the sense of hope and optimism that we're so close to being at the end of this pandemic. And indeed we are. But now is the time where we can't let our guards down. We need to continue to follow the rules that are laid out by Dr. Fitzgerald and her team at Public Health that has so wisely guided us through this pandemic to date. We need to push that extra bit, that extra gut check, that extra little push to get us to the end now as vaccines continue to ramp up. So please, to everybody in the affected communities, and frankly, everyone in our beautiful province on this long weekend, please stay safe, stay calm, respect the rules, and to echo Dr. Fitzgerald, don't stigmatize those with who you may have heard rumors about or who potentially even have COVID-19. The only way we will get through this is together, but we will get through it. So with that, I'll pass it over to Dr. Haggie for some brief remarks.
Thank you very much, Premier. Yes, not the way to spend May 24. We have a cluster of probably 42 if you add up the numbers that Dr. Fitzgerald read out. The challenge is that their contacts spread over quite a large geographical area. There's sporting events, there's family gatherings, and there's social events that have led to a list of possibly 300 contacts. Central Health, with support from the other RHAs, has risen to the challenge, and I've not been advised there are any constraints or difficulties with resources to do the contact tracing that is necessary. We do have other resources available should Central Health require them, and they stand by prepared. This is a young cluster as far as we can tell. Their mean age is 38 and their median is 36. We have deployed rapid testing. 280 of these have been used in the localities at the moment. We have no challenges with supplying more. 2,000 ID now have been delivered to Central Health, and we have a total inventory in the province of nearly 200,000 of various rapid tests. On the other hand, vaccine status is significantly different now than it was even with Codroy Valley. We are at just under 54% as of close of business on the 22nd of May. Now, obviously, this disease, COVID, has a lag built into it. It takes 2 weeks for even your first shot to provide the protection. And it takes 2 weeks for isolation and quarantine to determine the spread of any contacts. We can do it. We've done it before. And in actual fact, in Codroy, level 4 only lasted a week. So the next few days will tell us what these numbers show and what the trends are. And that will really guide us over the coming 2 weeks. We are vaccinating an additional 1% a day, and that will not stop. And as Moderna hopefully becomes available, we will be able to increase that using our local pharmacies and our physicians, who are also ready for when they get their chance to deliver the doses that we get from the federal government. So again, hold fast. We've done this before, and we can do it again. Thank you very much, Premier.
Well, thank you, Minister. I'll certainly echo your comments that it's so incredibly important that people get vaccinated now more than ever before. We're so close. So please get online, register for that critical vaccine. It is the single best weapon that we have to fight COVID-19. So please get registered and get your needle. With that, I'll turn it over to media for some questions.
Thank you, Premier. For the benefit of our speakers, there are 5 reporters registered for today's call. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Jackson with The Telegram. Please go ahead.
Good morning. I'm wondering if you have a sense yet of what the main drivers of this outbreak are. Do you have any sense of a super spreader event?
So certainly, can you hear me okay? I just want to make sure. Yes, so we do know that there were some social gatherings that where there was some spread, as well as some sporting events where there was spread. So we're still early days, but some of the initial spread appears to have happened in some of those situations. But as I say, it's evolving, and so more information, I'm sure, will be forthcoming in the coming days.
Other than the straight numbers, and given what you just said, how would you compare this outbreak compares with the February outbreak in St. John's?
Well, certainly it's smaller, and we don't see as many contacts involved in this outbreak, so that's a good thing. You know, schools don't seem to be involved to the same degree, and you know, a bit of luck on our side this past week was that the schools in the area were closed for PD days. So certainly that really helped us out. But yeah, smaller, fewer contacts by all accounts. And of course, not seeing this spread in that younger age group. Most people are over the age of 20.
The other thing, of course, Dr. Fitzgerald, I'm sure you agree, is different than February in the rates of vaccination within the province, and that does offer some degree of protection, albeit not perfect, but certainly a larger level of protection than what we had in February.
Yes, certainly the vaccinations make a difference. Yeah.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. And looking at some of the social media posts coming out of the area, a lot of people having to wait quite a period of time for testing yesterday, many of them waiting 6+ hours, still not getting tested, having to return today. Are we looking to have more staff on hand to help with the increase in testing? Are we looking to do some drive-through testing, as that wasn't an option just yet?
Kellyanne, the short answer is yes. There are community testing clinics in Lewisport today. Gander and Grand Falls are open, and public health will advise when you call 811 which is the line of best approach. Tomorrow, as normal business resumes, then the option exists to expand those, and public health are actually discussing locations for those kind of things dependent on today's figures. So I think Dr. Fitzgerald wanted to say something, so I apologize if I stepped on you there, Janice.
No, that's fine. I was just going to say that it's actually, I think we have to look at this very positively. Yes, people had to wait, but the reason they had to wait was because of the volumes of people that came out to actually get tested, which I think is wonderful. I think people stepping up and doing what they have to do to help protect their communities is a really good thing. So I encourage people to get tested, and we thank them for their patience. Central Health put this together very quickly, and everybody is doing the best they can do.
And looking to it, I know last week we presumed it was a variant of concern. Do we know which specific variant, knowing that they all spread just a bit faster than the COVID that we were used to several months ago?
At the moment, no. We have to get whole genome sequencing. We've done some screening, and it's not any of the original 3 variants, I guess, the 117, 1351, and P1. It doesn't appear to be, based on screening, one of those, but we're still waiting on whole genome sequencing to see if it's related to the 1617, which is the variant that was first described in India. So we're waiting to get that information at this point.
Our next questions are from Malone Mullen with CBC. Please go ahead.
Hi there, Minister Haggie. You mentioned sporting events playing a role in this outbreak. And of course, in February, sporting events also played a role. Is there a way going forward to safely play sports, or does this deserve a closer look at possibly introducing more restrictions going forward?
Well, I think with level 4, Dr. Fitzgerald has outlined what can and can't be done vis-a-vis sports. I think one of the interesting things is that each of these organizations who wanted to hold, competitions, non-tournament events, had to have a return to play plan. And I suppose one of the questions later will be to see if there are gaps in those plans or learning that we can take away from these particular events. I think the challenge sometimes isn't around the sport, it's around what goes on before and after the sport.
Prior to this outbreak, we were seeing a lot of cases coming in from other provinces. I'm wondering if contact tracers have a sense yet whether the cluster came about as a result of people not following self-isolation requirements.
So it's still very early days in the investigation, and I'm sure those questions will be asked and answered, and they will be looking for a source through all of this. But at the moment, public health is really focusing on finding every case, finding every contact, isolating every contact, and making sure that we do everything we have to prevent any onward spread of this virus in the area. So, those questions will have to be answered, but at the moment, that's not where our focus is.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi, thank you for speaking with us on this holiday Monday. First of all, Dr. Fitzgerald, could you explain the difference between a probable case and a presumptive case? I just want to make sure that we have that information right.
Sorry, Patrick, you cut out there after probable case. I didn't hear the rest.
Sorry, a probable case and a presumptive case, the difference between the two.
Okay. Okay, I'll start with confirmed case. A confirmed case is a case that is confirmed by our public health microbiology lab here in the province. So they have a positive test at that lab. A presumptive case is somebody who has been tested by a rapid test and gotten a positive result on that rapid test, but we're still waiting for it to be confirmed by the public health lab. So whenever somebody gets a rapid test done, they actually get 2 swabs done. They get one for the rapid test and one that goes to the lab. So once it's confirmed by our public health lab, then they become a confirmed case and they're no longer presumptive. A probable case is somebody who is known to be linked epidemiologically to confirmed cases and have symptoms of COVID-19, but for some reason cannot be tested or have not been tested, or the test was done and inconclusive. So that's what we would call a probable case. So a probable case may never change to a confirmed case. They may always remain a probable case.
Thank you. And could you tell us about the plan for schools in the area, which I would assume would have reopened tomorrow?
We're
Sorry.
we're still working with Dr. Fitzgerald, the district, and Minister Osborne to determine what the status of schools are. So stay tuned for updates later on today. But as Dr. Fitzgerald said, we've been pretty lucky that it hasn't exactly impacted schools in that there were some PD days last week. And so there is some level of protection with respect to cohorts within the cohorts of the schools themselves and within the schools. Dr. Fitzgerald, sorry, you were going to speak as well there.
Thanks, Premier. Yes, I was going to say we haven't seen a lot of cases in school-age children at this point, so that bodes very well. You know, our goal through all of this is to make sure that children can be in school as much as possible. So we will be looking at that closely.
Our next questions are from Brian Medore with VOCM. Please go ahead.
Brian, you may be on mute there. I think we lost Brian.
Okay, if he comes back in, we can circle back to him. I'll now go back through each reporter to see if you have one final question. Peter Jackson with the Telegram, do you have a final question?
Sorry, yes, I do. I'm just trying to pick which one. Yeah, you said that the Cogroy Valley only lasted a week, but there were no unlinked cases in that. Do you expect that this outbreak would only last that long?
It's difficult to say at this point. Certainly the results of the community testing will be quite informative in that regard. If we start to see any non-epilinked cases, that will be more concerning for us. We do know that there is, I mean, there's community spread, but at the moment, as far as we can tell, everybody is linked to somebody else, so that's a good thing. But you know, the community-wide testing will give us a better understanding of what's really happening in the community.
Thank you.
I will now go back to Brian Medore with VOCM. Are you there, Brian?
I think so. Can you hear?
Yes, you came in, but you cut off a little bit. Try again.
Okay, can you hear me now?
Yes, you're coming in crystal clear. You go ahead.
Okay, thanks. Sorry for that. There's a couple of hospitals in that area, Gander and Grand Falls, Windsor, but there would be people using those hospitals just on the periphery of the lockdown zone, or even outside, say in the case of perhaps the Bayvert Peninsula area. What would be the status of people, say appointments at those hospitals? Any changes, or if a person does have an appointment, should they reschedule? Can you give me any clarification there?
I'll take a stab at this one first, Brian. As far as the facilities themselves are concerned, the advice we are getting from Central Health is that they would restrict themselves to urgent and emergency appointments or attendances until such time as the geography in that area becomes clear. There are always options for care, and the decision is a clinical one based on the opinion of the physician in, for example, Bayvert. The COVID unit in Central is actually located in Grand Falls, Windsor at Central Newfoundland Regional Health Centre, and has capacity should that be necessary. We've checked on their figures. They have, I think, only 9% of their ventilators in use, and only 70-odd% of their beds occupied. So from the emergency point of view, they're covered, but elective planned work would probably be best deferred until level 4 is vacated or left behind.
And can I get a geographical dimension on it? I know it's Gambo to Badger and some other highways off the TCH, but can you give me kind of a furthest community north, furthest community in that area, some kind of a clearer definition of the lockdown zone?
Try Gambo to Badger on the TCH and go up as far as Change Islands and down as far as Gambo Pond and Norwest Gander on the eastern end. On the western end, I forget the communities, the end of Route 350. That's more Janice's neck of the woods than mine. There is a map, though. There is a map, though, on the that will be available for download or for examination on our website shortly.
I was just going to say, Brian, damn it, I'm a doctor, not a geographer. Yeah, so it's basically looking from Route 320, which goes down through Gambo, over as far as Badger, and then 350, which goes down through Botwood out towards Leading Tickles. So that whole area, excluding Change Islands and Fogo Island.
Thanks.
Kellyanne Roberts with NTV. Do you have a final question?
Yes, I'm getting a few of these, and I know on Friday, it's not the focus at this point, but a lot of people knowing that it takes 14 days for your vaccine to kick in to provide that immunity to the virus. Do we know how many people so far through this cluster have received at least one dose of their vaccine?
No, we don't know that information at the moment, Kellyanne. We're again, public health focusing on test, trace, and isolate, but that will be something we'll be looking into. Obviously, that's of great interest to us. If this does turn out to be a variant, especially 1617, we're very interested in knowing how the vaccine may help prevent spread of that. So we will be looking into it, but right now our public health teams and our epidemiologists are really focused on just managing the outbreak, and vaccination status at this point doesn't change what we have to do. So, but we will be looking into it.
Absolutely. Thank you so much.
Malone Mullen with CBC. Do you have a final question?
I do, yes. Dr. Fitzgerald, I'm very sorry to ask you to break out your crystal ball here, but given what you know so far, I'm wondering how possible it is that in the coming days, more of the province enters alert level 4 as a result of this outbreak.
So we're really hopeful that by putting this outbreak in place that we will not have to expand it, and that by expanding it to this degree today, that this will help to keep things in check and be able to really help us control it, to stop that onward transmission. Level 4 is really focused on trying to limit those situations where people can gather and to limit those social gatherings that can really contribute to spread of this disease. So we're trying to keep society open as much as we can, but still limit those situations where we know that that spread can happen, or happens much more easily and more quickly. So if we're able to follow the rules and try to keep our contacts low and follow that public health guidance, our expectation will be that we will be able to get it under control.
Thank you.
Patrick Butler with Radio Canada. Do you have a final question?
I do. Given that this is I guess you could call a hotspot for COVID in the province, is there a move towards ramping up vaccinations in that area of Newfoundland, given the prevalence of COVID there at the time being?
So at the moment, we're maintaining our vaccination programs throughout the area. At this point, we don't feel that the rates of disease at this point would warrant us having to divert from other areas of the province to vaccinate this area. Certainly that has, we've seen that happen in other provinces, and it does seem like it's a reasonable strategy when you have a lot of spread and really high rates of disease. We're not seeing those high rates of disease, thankfully, and the reason we're doing this is to prevent those high rates from happening. So I think at the moment, we're certainly going to continue on with our vaccination program as we have been. But though, those are always options that we have should things change.
Brian Medore with VOCN, do you have a final question?
Just one about the 50% retail can open. It doesn't cause a lot of issues, say, in a St. John's area where we do have more options, but can you just sort of give us an idea what that might entail in that area?
So basically, retail stores are able to open about 50% capacity. So every space has a capacity limit. So we're just asking that the stores maintain those capacity limits at 50%, so that people who are in, when people are in the stores and maybe coming into contact with each other, they're not running, they're not too crowded or bunched together. It allows for lineups at the cash to be spaced, that sort of thing. And then, of course, if anyone is waiting outside, we ask that the lineups be physically distanced as well, and people are wearing the masks and all that. So, so it's really just about the 50% capacity in the store.
I don't have to restrict hours or anything like that.
No, not at this point. Okay. No, we wouldn't say that. And restricting hours will increase the number of people in at any one time. So, it actually makes more sense to have it open for regular hours.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thanks everybody for joining on a long weekend. I certainly want to empathize with people in Lewisport and surrounding communities in central Newfoundland as they're trying to navigate this situation. But please know that we are on it. We are doing our best, and we have been through similar situations before. So we have the benefit of lessons learned. In addition, we have the benefit of 50% of our population being vaccinated with at least one dose. So we are on it. Hopefully we can get this contained within the next few days to week and get to the other side of this outbreak, just as we have with others. So please stay calm, be patient, be kind to your neighbors, and we will get through this, Newfoundland and Labrador. Thank you.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.